One of our secret of success is working for the community and in the community.
That's why we exist. We play the role of the bridge between the communities and the hospitals.
With a common goal to deliver villages and communities free of avoidable blindness.
You work with people, you work with communities to bring about change.
It's about empowering the people
to live with a dignity again.
To save everyone from the suffering that they would have because of blindness.
Arunachal Pradesh is located in extreme eastern part of India. It's one of the most neglected state of India, and they are also into extreme poverty.
The trained manpower is constrained here. Each ophthalmologist is responsible for services to 140,000 people.
This state has the second highest prevalence of blindness in India, which is 2.28% after Assam.
In the developing part of the world, we have huge gaps when it comes to availability of trained ophthalmic personnel and paramedical staff. So that's where we pitch in.
For the last 3 years, we have been operating from 100 cases every year to 500 cases every year.
What we do here is we conduct screening programs with the help of the ASHA workers and the government. Patients are brought to the camp. They are being examined by the ophthalmologist and the medical team, and then these patients are transported in the bus provided by Operation Eyesight to the base hospital.
And of course, when the patient cannot afford, or if the patient can afford part of the treatment, the funding which comes through this, it also helps us to deliver the same care to a patient who cannot afford any treatment at all.
Our team's heart and soul are into what we are doing, and they also feel motivated by the transformation that they witness.
In 2014, we did a survey to determine the level of trachoma in Narok. We found that in Narok, we had 4,011 people that needed surgery.
Trachoma is a problem in Narok, and in the world, it is the second largest cause of irreversible blindness.
And so the race was on to catch all these people and have them treated.
Narok West Sub-County has the highest prevalence of trachoma, which is 19%.
In developed countries, such as Canada, there are about 100 to about 200 ophthalmologists for every 1 million people. In my region, for example, it's 1 per million population.
And therefore, we believe in building the capacity of the local people and building the capacity of the systems that are there to be able to solve this problem.
We are at the moment doing a mass drug administration to treat the masses so that we reduce the load of the bacteria which is responsible for the disease, chlamydia trachomatis. We are aiming at treating 100% of the population.
The reason why we are here is the courage that the donors has shown us as an organization, because they believe in us, in our work, and because of that faith and that trust, we have been able to come so far.
We cannot say that Operation Eyesight can be able to solve all the problems, but we have the technique and the approach to build the capacity of the local people to be able to solve their own problems.
We share the same sunshine, we share the same oxygen, but why should one person actually be blind and not be able to be helped while another is able to? Yeah. That's an injustice which should never happen, but you can help bring about justice in the world.
Hello, and thank you everyone for joining us. My name is Candice Nayland, and on behalf of Operation Eyesight's global team, we are thrilled that you've tuned in to our 2020 Report to Community. We are joined today by board members from Canada, US, UK, Kenya, Ghana, Zambia, and India. We also have our international local partners with us today. And of course, we want to thank the donors who are here. Welcome to all of you. We have a short program prepared with our CEO, Kash Busnarmath, who will give you an overview of our 2020 annual report. After Kash's presentation, we invite you to join a breakout room to learn more about our initiatives, and feel free to join the conversation. We will give an overview of our program around childhood blindness in Kenya, our clean water program in Zambia, and the importance of vision centers from our India team. You probably noticed the breakout room button at the top of your screen, but please don't press it yet. I will come back on screen again to let you know when you can join my colleagues in the breakout room. I'd now like to begin the event and introduce our board chair, Shad Usman. Shad is a chartered professional accountant with a Bachelor of Commerce degree from the University of Saskatchewan. He is currently the CFO at S2 Architecture and is responsible for the overall financial reporting, strategic planning, budgeting, and forecasting for the firm. Shad has been working in the architectural industry for over 15 years and along with his role has been actively involved in promoting sustainable initiatives at both personal and professional levels. Shad joined the board of Operation Eyesight in March 2017. Prior to becoming our board chair, Shad was the chair of our Finance, Audit, and Risk Committee. With that, I'd now like to welcome Shad.
Good morning and good evening. Welcome. Thank you all for joining us for our annual Impact Celebration. 2020 was a year unlike any other, and we certainly have a lot to celebrate. I'd like to start out by recognizing the chairs of Operation Eyesight's international boards who are here with us. From Ghana, we welcome Nana. From Kenya, Ernest Muibu. From Zambia, Manoj Patel. From India, Dr. GC, and from the UK, Kevin Davidson. As a board, our role is to provide strategic oversight for the organization and to ensure we're fulfilling our mission to prevent blindness and restore sight. As you can imagine, in the face of the global pandemic, and as an international organization working in the health sector, Operation Eyesight needed to be flexible and adaptable so we could best navigate the challenges created by the pandemic and continue our impact. Thanks to the support of our donors, we were able to respond to this global emergency with compassion and care, while also moving our sight-saving programs to the next level. Because of our local, on-the-ground partnerships and our focus on community outreach and empowerment, we were well positioned to provide immediate support in the regions where we work. We kept our partner hospitals from becoming overwhelmed so they could get back to maintaining eye health as a priority sooner. We provided communities with the education and critical supplies they needed to prevent the spread of the virus. Of course, to continue our programmatic impact, our teams around the world also needed to adapt in terms of their working arrangements. We quickly shifted to working from virtual offices and hosting online events so we could stay connected with our donors, partners, and volunteers. Timely communication with our stakeholders was a key to our success. We needed our supporters to know that, despite the hurdles we were facing, we remained dedicated to our mission. And we were so grateful for your ongoing support. As the initial lockdowns lifted and the situation improved, we relaunched our programs in the fall, resuming our community outreach activities and eye screenings. While we already knew the importance of creating access to quality, affordable eye healthcare services, the pandemic has made this even more clear. We need to bring services closer to the community level, and the latest stats from the World Health Organization and the IAPB Vision Atlas further reinforce this. Around the world, 1.1 billion people are living with vision loss. 90% of all vision loss is in low and middle income countries, and 90% of all vision loss is preventable or treatable. Our mission is more critical than ever. Your support is more important than ever. Thank you for your generosity. Thank you for enabling us to keep eye health a priority so we can continue our impact. I would now like to introduce our President and CEO, Kashinath Bushnamath, to give our 2020 report to community. Kash became President and CEO this past March after 11 years with Operation Eyesight. He has more than 30 years' experience in international development and brings extensive leadership and expertise in program development, implementation, and advocacy. He first joined Operation Eyesight in 2009, spearheading the development of what has become our flagship model of hospital-based community eye health, and eventually overseeing all of our international programs, most recently as Vice President of International Programs before stepping into his current role. Cash serves on the International Agency for the Prevention of Blindness Board of Trustees and was recognized as an eye health leader in 2013. Cash also has a wonderful sense of humor, and his interactions with our staff around the world are filled with compassion, caring, and warmth. And with that, I would now like to welcome Cash.
Thank you, Shad. It's a pleasure and privilege for me to share with you Operation Eyesight Progress Report 2020. In my nearly 12 years with Operation Eyesight, I have never seen a year like 2020. We as a development organization have dealt with several natural disasters, such as the ones caused by floods and cyclones. But all these were localized and impacted only a small proportion of our target community. And they also negatively affected only a limited part of our work. COVID-19 turned out to be very different. As you already know, the global pandemic has impacted our partner hospitals, our vision centers, and our target communities too very negatively. It has spared no one. Despite the pandemic, we continue to work on our mission of delivering quality eye care services and empowering the target community to own and take responsibility for their eye health. Our models and projects in each one of our countries of intervention are such that we necessarily work alongside our partner hospitals and we have our presence right at the community level. We redesigned our intervention strategy, we put in place safety measures, and we reworked our action plans. As a result, despite the many challenges and constraints imposed by the pandemic, our partner hospitals, our community health workers, and our own staff delivered very impressive results during 2020. For example, we declared 5 villages as avoidable blindness free on a sustainable basis in Kenya. We were in the process of validation of around 100 villages in South Asian countries to be declared as avoidable blindness free, but we could not complete the process of validation due to the pandemic. We will be able to declare these villages only after confirming that we have left no one behind, which will be possible only after we move out of the pandemic. So, how was it possible for us to achieve all that we did during 2020? Quick decision made by the Board of Directors of Operation Eyesight, country program teams' commitment and willingness to work nearly 24/7 meant that our partner hospitals and vision centers continue to deliver eye care services while ensuring that it was completely safe for the patients and hospital staff. In other words, our enhanced emphasis given to quality and safety helped us to end the year on a positive note. Here, I would like to share with you a story from Zambia that has impressed me the most. One of the many things that we are doing in the field is drilling of boreholes and rehabilitation of defunct boreholes. I would like to appreciate the efforts made by our friends and colleagues in Zambia. Often, my colleagues carried new hand pumps and other materials weighing about 25 kilos on their shoulders, walked 10 to 25 kilometers well after the sunset to reach some of the remote villages in the central province of Zambia. They often worked through the night under torchlight. People of these villages are now with access to drinking water, perhaps after a gap of 10 to 20 years. This is an example of how your support helps the people for whom Operation Eyesight is working. As you can clearly see, it is not just about eyesight. You are actually the cause of many changes, such as access to clean water, which for people means life and livelihoods. So thank you. Another story I have for you is about our vision centers. As you might already know, our vision centers are located in remote locations and very close to our target communities. Because there's no access to the hospitals that are located in remote towns and cities, from communities' perspective, nobody actually suffered because of lack of access to primary eye care services. the people from our villages were able to get all the services related to primary eye care provided by vision centers. So these vision centers, because of our intervention, provide quality as well as safe eye care services. Some of the examples of what we achieved during 2020 include 1.5 million people whom we screened for various eye conditions. We conducted over 145,000 eye surgeries. We either drilled or rehabilitated nearly 250 boreholes in Zambia. We also trained over 400 professionals in providing primary eye health care. We also declared 5 villages as avoidable blindness free in Kenya. Thank you, everybody. The work we do would not be possible without the commitment and investment of every single one of our donors at all levels. We are also very grateful to those who have left a gift in their will to Operation Eyesight, to our anonymous donors, and to also our monthly donors. Thank you. Now, coming to the pandemic, Operation Eyesight decided to respond to the global crisis. It was a well-considered decision. Of course, we debated over the correctness of an eye health organization responding to the pandemic. Was it necessary? What about our own mission related to elimination of avoidable blindness? Since we have a presence at the level of target communities, there was no way we could turn a blind eye to the risk that they were being exposed. Saving eyesight, but not doing anything to save lives. We decided to do both, save sight as well as save lives. In the countries of our intervention, we saw large gaps in terms of preparedness at the levels of ministries of health, hospital partners, and their resources. We also found gaps in terms of awareness among our target communities. In consultation with the ministries of health and our partner hospitals, we decided to intervene with our COVID response project in 7 countries: Zambia, Kenya, Ethiopia, Liberia and Ghana in Africa, and India and Nepal in Asia. The major focus of our COVID response project was on 3 key areas. The first one was community empowerment. Like in the case of our regular intervention, education and awareness continue to remain our main focus as part of our COVID response project as well. We redesigned our information, communication, and education strategies and included components related to COVID-19, its symptoms, and safety measures, among others. We trained our community health workers, who in turn trained the target communities. The impact was visible. No cases of COVID were reported in our areas of intervention during the year 2020. The second major area of our focus was on clean water, sanitation, and hygiene. Again, these two are part of our regular work that we undertake for the elimination of trachoma. In the case of COVID, hand sanitization, clubbed with other measures, are vital for protecting ourselves from COVID. We distributed hygiene kits. We established hand washing stations in our facilities and vision centers, and we distributed also Veronica buckets among female-headed and other destitute families. The impact was again very glaring. For some families, Veronica buckets proved to be a boon. For the first time, these families had proper containers or vessels to store clean drinking water, and some got introduced to the idea of washing hands with soap for the first time in their lives. And the third and the last major area of our focus was infection prevention and control. Infection prevention and control is again a regular feature of what we do as part of our hospital strengthening program. But we needed to do a few things additionally to ensure safety of the patient and hospital staff. We introduced reliable triaging system, gave PPE kits, developed and introduced COVID-related protocols and guidelines, and train our partner hospital staff. To conclude on our COVID response, what we did collectively during 2020 helped us to save sight as well as life. We continue to remain committed to our main mission, that is, to work towards elimination of avoidable blindness on a sustainable basis. And without there being a drift, we will also do something meaningful to save lives. And all this was possible mainly because of the support that came from you all. Thank you. So thank you, each one of you. Actually, we have 6 million reasons to thank each one of you because we succeeded in raising over $6 million during the year 2020. So thank you for having made this possible. Thank you and thank you and thank you. Now I request you to please join a breakout room and learn more about our programs. So thanks again and best wishes.
Thank you, Kash, and thanks to all of you for helping make this impact possible. This concludes the formal portion of our report. However, I encourage you to stay and join a session and learn about our programs and hear directly from our international team experts. I now invite you to join and locate the breakout room button at the top of your screen, and you will be asked for your information to enter the Zoom session. Once there, click on the breakout rooms at the bottom of the Zoom window and join a room of your choice. Thank you and see you there.